Hello, Cecilia here from the University of Victoria. I'm a scientist at the Canadian Institute for Substance Use Research, and we are on Indigenous lands here at the University of Victoria. So I'm a settler for the last almost 4 decades in Victoria. I'm originally from Newfoundland, of Mi'kmaq, French, and English background, and all my life I've tried to hone a sociological eye about marginalization, and in particular about how we might improve access to health and healthcare for Canadians. So thank you for this honor, and I'm reflecting on why I might have been chosen for this award. I think it may relate to some of the research I've been honored to be part of for the last 4 decades. I began my career looking at or trying to understand the question of why midwives were excluded as legitimate workers in Canada while they were honored to be so in many other countries, including research I had done in Sweden. And I've worked to shed light conducted research with midwives and to women seeking midwifery care to try and change those policies. And we actually have been successful. Today, midwives are working in most parts of the country. They have access to public education, and they also are paid, their services are paid through the public purse. So that's quite a wonderful change in a lifetime. Other research I've also been invited to be part of and have helped conduct research through funding from CIHR and some other agencies have to do with understanding the situation of Indigenous women in our inner cities, including the downtown east side, working with street-involved youth, trying to tell their story about social exclusion, marginalization, and how to build services that are more appropriate for them. I've also worked with pregnant women who are dealing with substances and other challenges, and thinking about developing one-stop healthcare community centers that can better give care to them. And perhaps the most recent group group that I've faced some of the most marginalization in Canadian society is my work with sex workers. So CIHR has funded a number of projects where we have tried to shed light on what the backgrounds of sex workers, what the health challenges they are facing, about the policies and practices, the laws, criminal code laws in particular, that really limit their life choices, and then to develop to bring sex workers to the table, the organizations that represent them, and try to think about more inclusive policies that help improve their situation and their children for coming up. So these are some of the projects I've been lucky to be working on. It's an assortment of different research projects that all are focused around marginalization, social inclusion, and thinking about how we can improve Canadian society so that some of our more the bigger challenges, the ones that COVID have really exposed to how we have failed really to provide ongoing service fund, non-judgmental services and funding for excluded populations. So my work is really going to continue on to work with those groups, and hopefully we get through this pandemic, and then some of the changes we have made can become part of public policy, and also part of our public healthcare system that will lead to greater inclusion for the most marginalized. So thank you again.